We're going to talk about a methadone dispensing pharmacy and what do you need to know. Our learning objectives today are to be familiar with the basic requirements for implementing a methadone maintenance treatment program in a community pharmacy. We're also going to discuss patient-specific requirements when enrolling patients in a methadone maintenance treatment program, understand the labeling, documentation, and dispensing standards for dispensing methadone. We're going to list the staff training requirements and dispensing requirements for dispensing methadone. And we're also going to review the policies from both CPSO and OCP that pharmacists should refer to when dispensing methadone in Ontario. Our agenda today is methadone in Ontario. What is methadone maintenance treatment? Issues to consider before deciding to dispense methadone. Issues to consider after deciding to dispense methadone. Transfer of custody, the references and resources you should have. Ending the pharmacist-patient relationship, and how to stop dispensing methadone. Statistics for methadone in Ontario as of 2015. So the number of patients enrolled in the program are 42,000. Now, this statistic only goes up to July 6, 2015, as the patient register was abolished at that date. The number of physicians prescribing methadone is 470, and that would include both pain and addiction. And the number of pharmacies dispensing methadone would be 1,118, and again, that would include those dispensing just for pain. So what is methadone maintenance treatment? So methadone maintenance treatment is an effective pharmacological treatment for opioid dependence. It is the daily oral administration of methadone over a prolonged period as an oral substitute for heroin or other like drugs for patients who are dependent on or addicted to these drugs, and this definition comes from the CPSO policy statement number 210. So who regulates methadone? Methadone for the treatment of opioid dependence is regulated by a number of institutions: Health Canada in partnership with the Ministry of Health and Long-Term Care, the College of Physicians and Surgeons of Ontario, and the Ontario College of Pharmacists. So what do I need to consider before making a decision to dispense methadone? So there are operational issues to do with the physical premises. So you have to ask yourself, what is the physical setup of your dispensary? And is there a semi-private or private area for methadone administration and counseling? Ideally, it would be a private area, but semi-private is fine. Is there sufficient space for preparation of methadone doses? So depending on the size of your pharmacy, you may have to make some accommodations there. Pharmacy hours. Do your current hours of operation suit your clients? Most clients come for dose administration in the early mornings from 8 to 10 a.m. So if you're only open at 10 a.m., likely you won't have very many clients. And are you open 7 days a week, including holidays? And ideally, the pharmacy should be open 7 days a week, including holidays. However, it is permissible to open for a few hours on Saturday and or Sunday to administer methadone. It is not permissible to assume that you may dispense a take-home dose if your pharmacy is closed on Sunday. For staffing, are your pharmacists capable, trained, and willing to administer methadone? If they're not trained, are they willing to be trained? And what does the pharmacy staff think? There are many misunderstandings and preconceptions about methadone patients. Will you be able to get relief for part-time pharmacists who are trained in methadone dispensing? Clients or patients, was there a patient request to dispense methadone, and is that the reason why you decided to dispense it? How many patients can I or do you want to serve in your practice? And what will my other clientele at the pharmacy think? Is there a methadone prescribing physician in the area? Is there a list of methadone prescribing physicians? The answer to this, of course, is no. And is there a website with a list of methadone prescribing physicians? There is no general website with a list of methadone prescribing physicians. However, you may find websites that are supplying information to clients and patients who are looking for a methadone prescriber. So what kind of equipment do you need? You need to purchase a calibrated pump, and again, there's various sizes available depending on the volume that you're going to be using. And there's a couple of different brands, Brinkman and Dispensat is just two of them. The pump needs to be calibrated and cleaned regularly as per the manufacturer's instructions, and it costs approximately $500. As an alternative, there's a methadone system, a computerized methadone dispensing program, and we've listed the website there for those of you who want to look it up. It's an integrated software with measuring and dispensing dose. It is also probably more expensive, although you do have to consider that it integrates a number of dispensing processes. The other equipment you need a safe to store methadone stock bottles. You will need 100 ml bottles with safety caps. An optional treatment is tamper-proof seals, which can be purchased separately, and you can also purchase now bottles with self-sealing lids. You also need disposable cups, sufficient size for approximately 100 ml. Waste disposal service for the bottle return. The auxiliary warning labels may also be printed by the software or typed on the prescription label. Other considerations: so will the pharmacist be readily available to check the accuracy of the doses, assess the patient for signs of intoxication, and counsel the patient when necessary? And again, it depends on your practice how busy your pharmacist is. Can the pharmacist also assess drug interactions and contact the prescriber in an emergency? So once you've decided to dispense methadone, what happens now? You need to notify the College of Pharmacists within 7 days of starting to dispense methadone, and we provided the link for downloading the form that you need to complete. And this is a sample of the type of form. And the important information to put down there is the hours of operation, including the days and hours the pharmacy is open, the name of the designated manager and the date he or she completed the CAMH course, or alternatively, if they're registered for the course, then they would put that date down. If you're not yet registered for the course, then put to be determined. Name or names of staff pharmacists and date he or she completed the CAMH course, or again, the date he or she is registered for the course, or estimate when you're going to be able to take it. The type of methadone dispensing: is it pain, is it addiction, or is it both? And also, are you doing transfer of custody? Just briefly, transfer of custody is when methadone doses are sent to a clinic for administration by a nurse or another regulated health professional under delegation by the physician. Now for training. Mandatory, you need to take the CAMH Opioid Dependence Treatment Core course, which consists of 5 online modules and a 1-day workshop. The initial training must be completed by the designated manager within 6 months of beginning to dispense methadone. Now, the college does recognize that the courses fill up very quickly, and sometimes you might have to wait more than 6 months to register for the course. The course costs approximately $500. And as well, at least one staff pharmacist must complete the training within 1 year. And again, just a reminder that the classes do fill up quickly, so register as soon as possible. When class dates are decided, a mass email is sent out to those on the waiting list, and it's a first come, first served. So rather than wait to see if you can get someone to work for you that day, the best thing to do is register for the course and then find out if you can do the 1-day workshop date. Training has to be renewed every 5 years. So for renewal of training, the Ontario Pharmacists Association Live 1-day methadone, buprenorphine, and the Community Certificate Program, or the completion of 5 online modules, including the mandatory module, Policies Guiding Methadone Dispensing in Ontario. So what about the patient agreement? In this case, we're going to talk about the two-way, the physician-pharmacist agreement. So it must be signed by each client or patient in your practice. Now, the types of things that might be included are the expectation of all parties concerned, including the hours of operation and the consequences of inappropriate behavior. You need the patient's consent to access and share personal health information with other health professionals. A notice to the patient that doses will be withheld if the patient appears intoxicated or under the influence of substances. And a notice to the patient that missed, lost, stolen, or wasted doses will not be replaced without a new prescription. And it's worth noting you need to revise this agreement if there are significant changes in your pharmacy's policies. So in the cases where you change the hours of operation, or possibly you've purchased a pharmacy and you may want to redo the agreement. So ensure your agreement reflects your current practice. So in other words, if you do bottle return or locked boxes, that should be reflected in your agreement, and vice versa. It should not list that bottle return and locked boxes as part of your agreement if you're not doing it. Don't have the patient just sign the agreement. You should be reviewing the agreement with him or her and discuss the important points. And in some cases, you may need to have the patient take the agreement home and have a look over it. The agreement needs to be professional, not negative. I've seen agreements where it's do not do this, do not do this, do not do this. Try and make it a positive experience. Consider a separate take-home or carry agreement. Obtain emergency contact information for the patient, and in most cases you will include photo ID. In most cases it's a copy of a driver's license. A sample This patient agreement is available in Appendix 4 in the current CAMH reference text. So, setting up your dispensary for methadone dispensing. You should assign a private area of the dispensary with low traffic and minimal interruptions, and organize your layout. Where are you going to place your methadone stock bottle? And if you're getting doses ready ahead of time, is there sufficient room to lay out all the bottles without danger of mixing up patients' doses? Do not give clients the impression that you're hiding what you're doing. You want to have a private, quiet area, but you don't want to look like you're in a small room by yourself. Is there a private area for you to administer doses? Are you close to the counseling room area if a patient wants to speak to you in confidence? And often, at the counter is not the best place to do this conversations. Who will measure and prepare the doses? And where will you store your methadone stock bottle? So upon receipt of a methadone prescription, what happens then? Are all the required elements present on the prescription? Is there a valid stop and start date? The directions for dose must indicate if it's to be observed by the pharmacist or if there's take-home doses. Dispensing must occur daily, and the dose amount should be numerically and spelled out. It also includes the patient health card number and the CPS number for the prescriber. So here we have a sample prescription, and it is missing the prescriber's CPSO number. So the methadone prescriptions must adhere to start and stop date, and if doses are missed during this time, they are not to be considered as owing to the patient. All missed doses communicated to the prescriber. The physician must indicate if take-home doses can be provided when the pharmacy is closed. Do not assume that it's this way. Preparation of drink doses, preparing the dose. You must accurately measure the methadose using a calibrated pump or using the Methameasure system, and dilute the dose in approximately 100 ml with orange drink or Tang in a disposable paper cup. And for those patients that want a sugar-free option, use Crystal Light. Administering a witness dose. You need to positively identify the patient and assess the patient for intoxication, and it's only the pharmacist that can assess the patient for intoxication. You need to confirm the dose, and when we say confirm the dose, you should be asking the patient what the dose is, rather than say, is your dose this? Pour the dose into a disposable paper cup, and after consumption, talk to the patient to ensure the entire dose is consumed. You would need to record the administration of the witness dose, including the time, and any observations about the patient. In some cases, if the observations are important, you would notify the prescriber. Preparation of carry doses. You need to accurately measure the methadose using a calibrated pump, again, or Methameasure system. Dilute each take-home dose to approximately 100 ml with orange drink or Tang in bottles. And again, for sugar-free drinks, use Crystal Light. Close the bottle with a child-proof safety cap. The child-proof safety cap is compulsory. It's not optional. There is no waivers. There's no opting out of it. You can also use tamper-proof seals if that suits your practice. You need to prepare the prescription label. We have two samples of prescription labels that are acceptable. And again, these are referenced in the College of Pharmacists practice tools. And you can see that it's methadone, 50 milligram in orange drink, and the drug identification is 50 milligrams methadone. MAL is the manufacturer and the DIN number. And this second example, we still put down methadone 50 milligrams in orange drink, but the drug file is different. It's 5 ml methadone, 10 milligram per ml is the stock solution, and again, MAL is the manufacturer and the DIN number. So the record of administration is up to you how you want to prepare the record of administration. In some cases, a manual or paper form might be suitable to your practice. In some cases, people use patient profiles, calendars, that type of thing. And you may have the type of software that will record it electronically. You need to confirm the number of take-home doses and the dose with the patient. And what this means is not just giving the patient the take-home doses and then letting them go. You need to show them that there's 5 take-home doses, place it in the bag, and give it to the patient. You don't want the patient to call later and say, I've only got 4 doses. So also note, for transfer of custody, records of administration at the clinic must be provided to the pharmacy at the end of each day. There's a commercial solution on the market, and again, that's compulsory, but there is exceptional dispensing of compounded methadone solution. Compounding is only permitted in the event of a therapeutic need or lack of product availability and must be completed according to the OCP guidelines for compounding preparations. In the event that, pursuant to a prescription, a patient requires a concentration of methadone that is less than that provided by the manufactured product. So in other words, the manufactured product is 10 milligram per mil, and for those of you that need a small dose of 1 or 2 milligrams, you would prepare that commercially. The alternative is when a patient is unable to tolerate the commercially manufactured drug product, the pharmacist is permitted to compound a solution at the required concentration for that patient. At the end of the day, you need to review your records of administration and notify the prescribers of all missed doses. You need to clean the calibrator pump or the method measure system according to the manufacturer's instructions. Clear up your work area, leave it clean and organized for the next day. We'll talk briefly about transfer of custody, and again, this doesn't apply to all pharmacies. So pharmacists in some cases will transfer custody of individually labeled doses of methadone to a physician or his or her delegate, and the physician or delegate must sign the patient manifest on a daily basis to confirm that they have received each correct dose. Now, a delegate is a currently licensed, registered nurse, registered practical nurse, registered nurse, extended class, or healthcare professional regulated under the Regulated Health Professions Act who have demonstrated to the satisfaction of the physician an understanding of methadone maintenance treatment, including the risks associated with it. And there is paperwork on file at the clinic associated with this. Pharmacists must directly hand the doses of methadone to the physician or his or her delegate, or use a method of transportation that ensures that they are aware of and can track who has custody of the drug at any given time to ensure safekeeping of the methadone while in transit. This would be a chain of signatures, tamper-proof boxes. Also, it's important to note that anyone who handles the methadone at any point in transit must have their name and signature documented. All methadone must be transported in an accountable and secure manner, as described above, and in such a manner as to avoid extremes in temperatures or delays in transport which could compromise the drug. Now, what kinds of references do you need? You're required to have the CAMH Opioid Agonist Maintenance Treatment, A Pharmacist's Guide to Methadone and Buprenorphine for Opioid Disorder, the 3rd edition. This replaces the Methadone Maintenance, A Pharmacist's Guide to Treatment, 2nd edition. You're also required to have this text when you go to the course as well, or to take the course. Also, you need CPSO Methadone Maintenance Treatment for Opioid Dependence Policy Statement number 210, which is prepared in 2010. What additional resources would you need? It's recommended that you have the College of Pharmacists fact sheet, Key Requirements and Methadone Dispensing, and we provided the link there. All the information that you would need is on the one document. College also provides methadone practice tools. Again, we provided the link. Ontario Pharmacists Association provides a methadone toolkit for pharmacists. The updated version is currently on the website. There is also online modules from OPA, and they also provide an opioid substitution therapy drug information line, and the phone number is there. Again, it's Monday to Friday, 9 to 5. And you also can participate in the methadone maintenance treatment for opioid withdrawal discussion forum, and you can just register at that link. So how do you end the pharmacist-patient relationship? So the patient relationship cannot be terminated without good reason, proper notice, and an opportunity given to the patient to obtain another pharmacist or pharmacy services before discontinuation. And you must communicate this decision to the patient in writing. It should be clear to the patient that you will not terminate services before he or she finds another pharmacy. You need to provide a reasonable amount of time for the patient to find a new pharmacy. Remember that not all pharmacies dispense methadone. You can, of course, assist your patients in finding a new pharmacy dispensing methadone. Now, you may wish to inform the patient's prescriber of your intentions to end the methadone services for the patient, and you should document your decision and rationale according to documentation guidelines and keep a copy of this letter. Now, if you decide to stop dispensing methadone altogether, again, you cannot immediately stop dispensing methadone. Give your patient a reasonable amount of time to find a new pharmacy dispensing methadone, and you can assist them in finding a new pharmacy. You need to notify the College of Pharmacists in writing or by fax or email that you no longer wish to dispense methadone. And you may also wish to notify prescribers of your intentions to no longer dispense methadone. The important points to remember is you need to be empathetic and understanding, but remember there are professional boundaries. Treat your patients with dignity and respect, and they will share the experience with their friends, and this may lead to an increase in the number of patients you serve. As with any narcotic, exercise care in preparing the doses. A small mistake in measuring the dose can have serious consequences.